Do you notice burning when you pee? Or you notice a discharge that you're not comfortable with? Or even worse, you notice you are actually experiencing lower belly pain that won't just go away. For many, the first question that pops is this a urinary tract infection? Or could this be a sexually transmitted infection? Hello there, welcome back to my channel. I'm Dr. Sisi, and today we shall be talking about a common question that might confuse a lot of people. UTI versus STI, that is, urinary tract infection versus sexually transmitted infection, especially in men. I will walk you through the symptoms, the causes, and how you can tell the difference. Because guessing wrong could actually lead to a delay in getting the right treatment. So, a urinary tract infection often happens when a bacteria, commonly the E. coli, actually enters the urinary system. And in men, it can affect the bladder, the urethra, and even worse, can even affect the kidneys or the prostate. UTIs are actually more common in women, but some men can still get them, especially older men, men with enlarged prostates, and even men who use catheters. So how does urinary tract infection symptoms present? Well, some people may actually experience a burning or a tingling sensation when they pee. Some people may experience frequency, that is, the constant need to pee. Some people actually notice that their urine is cloudy and foul smelling. Or some people may even experience bloody urine. Other people may actually complain of pain in their lower abdomen, or some people may even complain of back pain. Aside from all these symptoms, some others may experience fever or even feeling tired in addition to these other symptoms. So unlike what people might actually think that UTI might be sexually transmitted, it is not. UTIs aren't usually caused by sex. They are more often due to bacteria spreading from the skin or the bowels to the urinary tract. Now let's talk about sexually transmitted infection, STIs. These are infections that can be passed from one person to another through sexual contact. And STIs common in men may include gonorrhea, chlamydia, trichomoniasis, HIV, syphilis, or herpes. Now, how do the symptoms present? Actually, STI symptoms can vary in men, but they often include discharge from the penis. The discharge can be whitish, yellowish, or even greenish. Some people may experience symptoms similar to that of UTI, like for instance, a burning sensation during urination. Some people may even experience pain during ejaculation. Some may notice that their testicles have become painful or swollen. Some others may experience genital itching or even blisters. Some people may also notice rashes around their genitals, and some may actually experience fever or feeling fatigue. But now, a key difference is STIs are actually caused by sexual contact, and often symptoms appear a few days to few weeks after an unprotected sex. Now, let us see how we can tell the difference between STI and UTI. While both can cause painful urination, there are still some key differences that are worth noting. First, as I said earlier on, both might actually have painful urination. But aside from this similarity of painful urination, discharge is rare in UTI. So when you notice you're having any penile discharge, it's most likely an STI. Now, if you notice your urine has a foul smell, it is most likely to be a UTI than an STI. Fever may actually be common in both, but is usually more in UTI. Now, you notice you're having genital sores. This is most likely STI than UTI. And another key difference is STI is usually linked to sexual relations, unlike UTI, that is just a urinary tract infection. If you have had unprotected sex recently and you start experiencing any of these symptoms, you might want to think of STI rather than a UTI. But if you notice your symptoms developed slowly over a while, and you're also experiencing probably back pain, suprapubic pain, smelling urine, it might likely just be a UTI. I know sometimes it can be hard to tell, is this a UTI or an STI? Because some of the symptoms overlap so much, it is not so easy to tell the difference. For example, chlamydia and UTI can both cause painful urination. Gonorrhea can cause discharge that can actually be mistaken for a UTI. Now, prostatitis, which we often refer to as inflammation of the prostate, can even present as both. That is why testing is essential. So don't try to treat yourself or guess. You need to visit your healthcare provider. So how do we establish a diagnosis between a UTI or an STI? So when you come to the clinic, the doctor might ask you some questions, take a full history about all the symptoms you've been experiencing. Then we might need to run some tests. So we might need to do a urinalysis, or we might need to do a swab test if you're experiencing any urethral or penile discharge. We might also run some blood tests for HIV, syphilis, herpes, or hepatitis. So getting the right diagnosis is critical. We might also want to even do a prostate exam if we suspect there's prostatitis, that is an inflammation of the prostate. If it is an STI, it is actually important to also screen your partner. So it's important to also get your partner tested and treated even if they don't have any symptoms. So when do you need to see a doctor? I've told you about the things we do when you experience the symptoms and when you come to the clinic. But when do you need to see a doctor? So here are some things you need to take note of that will tell you it's time for me to see a doctor. So if you notice burning or pain when urinating that lasts for more than 1 to 2 days, you might need to see a doctor. You notice discharge from your penis, or you notice blood in your urine, or even your semen, you might need to see a doctor. You notice you're experiencing fever or chills, or even pain in your lower back or testicles. This is important. You need to see a doctor. You notice any sores or rashes around your penile region, you need to see a doctor. And if you have had unprotected sex recently and you notice some unusual symptoms, it might just be worth getting checked, because delay can actually lead to complications and we don't want that. So you don't want to delay, because based on the kind of infection, some can actually lead to infertility or you even spreading it to your partner. So you want to get tested and treated as soon as possible. Now, what preventive tips can I advise for both? So either it's for UTI or for STI. What preventive tips do I want to leave you with today? You want to try to pee after sex. It can actually help flush out any form of bacteria. You want to ensure to stay hydrated and maintain a very good hygiene. You want to use condoms for protection. And you also want to avoid holding your urine for too long. These tips can be life-saving. Remember, your body is always talking to you. If something doesn't feel right, get checked. UTIs and STIs are both treatable, but ignoring symptoms can actually lead to serious problems. Thank you for joining me today. If you found this video helpful, don't forget to give this video a thumbs up. And if you haven't subscribed, please hit that subscribe button now. And don't forget to turn on your notification bells. You can also share this video to people who might find this video helpful. Thank you for joining me. See you on my next video. Bye.